Thank you for joining us. I'm Veronica Robinson, great-granddaughter of Henrietta Lacks, granddaughter of Lawrence Lacks, and I'm proud to lead my family's Henrietta Lacks initiative, HeLa 100, to partner with a project I've been working with as a member of Fund 2 Foundation Black Maternal Health Equity Project. Today, October 4th, marks the 73rd anniversary of Henrietta Lacks' passing and the discovery of her HeLa cells. Join us for part 2 of my conversation with Dr. Charis as we celebrate our Henny's legacy by giving her her flowers and talk about how we nurture our families. We nurture so many women around the world stories just by saying that we need to, as one unit, say, like, let's move forward, let's be progressive, we can do this. We don't have to always be, especially like in my grandmother's story, like we always used to be the last to know. So we want to tell the communities, like, you don't have to be the last to know anymore. You don't have to be left behind. You can be a part of the conversation. A lot of people believe that they know what it's like to come from these communities. A lot of people think they know, or they meet us before they meet us as people of color. And we always have that disadvantage. Mm-hmm. So being out here and being able to use my platform, being able to be part of NurtuHER and the HeLa 100 conversations, it's my way of saying that we have to do something different. We can't keep living this story of salts and the smallpox vaccines, or the Henrietta Lackses, or the Trayvon Martins, or stories of women who were laid on barns and cut open because they believe we felt no pain. We are human. We are here, and we're very much a part of this conversation, whether you like it or not.
I love that. That is so powerful.
Because we know the percentage of Black women in medicine, just minorities itself in medicine, is very low. So what did that look like? Is it a lonely?
It can be lonely from a training standpoint, when you're looking at your colleagues and you don't necessarily see yourself. But with the advent of social media and just a lot of online communities, I found other practitioners that are Black women. I've been able to go to conferences and have different kind of support groups. And it is amazing when I walk into a patient's room and they are so excited to see that I look like them.
I appreciate that. So I know that with you having this little one on the way, and you have an upper hand because you are a doctor, you're an OBGYN, and you have all this great information, but your husband is not. And when you go to the doctors, he's at a disadvantage because you already know what he don't know. What advice could you give families to begin those conversations and to be sure that when your spouse or your significant other, or your friends, when they go to the doctors, what advice could you say, like, hey, let's slow down, make sure this person understands? Like, how could you give that advice?
Yeah. So I love that you point that out. It's not enough for me to just understand. It's not enough for us to understand in silos and islands. We have to bring everyone in. And so part of that looks like bringing my husband to all of my prenatal visits. And they'll say, well, you know this. We don't have to talk about that. I say, no, explain it. Because I want to make sure that my husband knows, and he actually wants to know too. And the most beautiful thing, it was so touching at one of our visits, when they talked about some of the risk factors that I have and things that were important for me, my husband got teary-eyed. He said, how can I make sure that she's not stressed? How can I make sure that that doesn't happen? And what I realized was by creating space for him and inviting him into that area, it gave him agency. He felt like, I actually do belong here. Not only do I belong here, I have power to affect the outcome. And I was like, you do. We're in this together. And it allows for us to kind of reiterate that role of community and partnership and family. And so my advice would be to bring folks into the conversation. Don't try to hide every health condition. Don't worry about someone being worried about you. It's a shame when people are worried about you but don't have enough information to help you. Give them the information that is necessary so that you can receive the help that you need. And part of that is, as Black women, being receptive to help. And sometimes that's really hard. It's something we have to unlearn because we are everyone's help. We are everyone's support, but we need that support too. And we can often get that but just being a little bit more open to the people around us that love us, who desperately want to show up for us, but don't always know how.
I often talk about that in a way of those generational mantras and things that we grew up to believe and things that we really have to do away with. And I remember hearing a lot of women in my family say, if I don't do it, it won't get done right. And those type of things make men feel like they're at a disadvantage as a household. And they're just like, you know, or the sayings like my great-grandfather says, that's a woman's job.
Right.
Is it truly a woman's job to carry a child, especially if we made it together?
Okay.
So there's a good partnership. And I'm not just talking about I carry this baby, go through the sickness, and you get to eat snacks with me. But on another level, like, what do those roles look like to you? And how can we convey those to community so that men understand, like, we want you here? And how do we allow moments like that for your husband to allow him to be soft and vulnerable and not feel like it's a man up situation? Like, he has to always be tough. We got to be protective. He got to be tough. It reminds me of that song, I'm Every Woman. Like, we're so used to being everything. We're like, if we stop juggling, what's going to happen?
Right.
Like, everything's going to fall apart, but we never give that opportunity to the man to say, it's okay to stop juggling. He got me.
You know, as you bring that up, it reminds me of a convening on Black maternal health with the Fund 2 Foundation, where there was a doula, male doula, who trains fathers to be doulas, who said birth work is family work. And that really stuck with me because when you think about birth, and not just like the mechanism of pushing out a child, but what it means to give birth to a life and to grow your family, it is truly family work. And so if we stop thinking about just the functionality and all of the things, the parts in the uterus, we start to expand it, and family reveals itself as being everyone's job, right? And so people don't feel like, oh, I'm stepping into this space that I'm not supposed to be in. You're a part of this family just like anyone else. Families are not just comprised of women. Men are there too, which means you are a part of this, and your role is just as important. And so it is everyone's job to be a part of this conversation, to feel like they have a stake in the fight, right? And then when you feel like you are bought into something, you feel like you're a part of it, and you start to see how you can affect change. If you feel like you are powerless, you don't tap into your power. You're not going to wield anything because you don't feel like you can make a difference. By letting people know, not only can you make a difference, you must make a difference. You cannot opt out. That's how you tap family in.
So when it comes to women empowerment, we've learned today how to do it for our spouse. We learn to do it together with each other. How often in our communities, I see a lot of women don't want to adjust each other's crowns. How do you empower another woman? How do you adjust her crown and say, sis, we got this?
Yeah. You know, in a lot of our relationships as Black women, we can see the beauty, the talent, the power, the bossness in our friends, and sometimes even in our sisters, more than they can. And I think sometimes just holding that mirror up to them, not to break them down, not to criticize them, but to really lift them up and say, actually, you are so, so powerful. Look at all you've done. Look at all you've accomplished. Look at what you're capable of. That to me is how you adjust someone's crown. I also encourage mothers and daughters to really show up for each other in a similar way. You know each other better than anyone else. This society is going to put so much on our girls, so much on Black women, so much on us. It is up to us to say, you are more than this situation. You are more than what they say you are. You are capable of so much more. And so part of it is being able to say, I see in you what you don't see, and I'm not going to rest until you see it too. And that's something that's really important to me because I know my sisters do it. I'm thankful to everyone who does it for me because there are days when I don't see it. There are days when I say, can I do this? And it is so crucial to have someone in your community, someone in your corner that says, not only can you do it, you always do it. And I believe in your ability to do it.
I love that. So let me give it a try. That's the Charis. You are everything. You got this in a chokehold.
Oh, yes.
You are it's not where you started, but where you're ending, that you are powerful beyond measure.
Thank you.
And that your Essence Awards is only the beginning of all groundbreaking things that you'll be doing. That it took strength, it took courage, not knowing where the period doctor to go, but she's on the go. And not only will women and men and young women be inspired by her, but your newborn baby, when that baby comes, is going to be so proud to know that even when you didn't see this coming to fruition, your thought process, what you thought it could be, he's going to be so proud to say, that's my mama.
Oh,
That's Kira.
so sweet. Oh my gosh.
As I think about what you just said, I really took the time to digest and reflect back on to my family story beyond Henrietta, thinking about my Aunt Deborah and my a name that people hear they don't hear at all mostly, is my Aunt Elsie as well. She had a disability. She couldn't care for herself. And my grandfather took on a role as a caregiver for her. And throughout that, because my grandfather couldn't protect her from things that was happening to her, and even like her not being able to speak up for herself, which is really a reason why it's important for us to be a voice, not just for family, but for people who don't have a voice, or somebody who might just see you do the period doctor and feel empowered. It reminds me that Elsie didn't have that power. And that my grandfather, before he passed away, part of his legacy was speaking up for Elsie and saying his mom's name and sharing those parts of the story that are very uncomfortable for him and other people who might have also experienced these type of situations.
Yeah.
So that was his way of nurturing her. It's very important, and I can't emphasize this because my grandfather, he was definitely everything to us. And he showed us what having a strong man who was always willing to go first to be sure that he protected us. And I know that coming from the communities that I come from, that we always, like, as women, I see in my family, we're really, really strong.
Yeah.
And it's like they birth us as protectors. And we forget to be soft and allow that man to have that space to actually be a leader, and I actually allow him to teach us something. You know, so my grandfather, he taught me so many different things. That's also a way that we nurture Henrietta's story. Thank you again to Dr. Charis and Fund2 Foundation for collaborating with the Lacks family to honor our phenomenal Henny, the mother of modern medicine. Remember, we are the authors of our own stories. Say her name, Henrietta Lacks. Thanks again, Dr. Charis, for being a trusted voice in the white coat for us.
Thank you for having me.
If you're interested in keeping it going, you can join the conversation with the Lacks family at HeLa100.org or CELLebrate HeLa.
And you can follow me on Instagram at @theperiod_doctor.
If you want to learn more about Fund2 Foundation, Nurture Her Village, follow on Instagram at BMH Equity.